Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to welcome you to episode 186 of the Ask Dr. Angela podcast. So recently, I was in the kitchen baking with my mini-me. You all know I do a lot of baking, and we baked cheesecake. That's a pretty tall order, being that it was the real cheesecake, not like the no-bake Jell-O one, but the one that involved the cream cheese, the sour cream, spring pan, the whole shebang. So we baked this cheesecake. It's all good. We go to see Hidden Figures, which is an amazing, amazing movie. We come home, cut the cheesecake, which had strawberry topping, by the way. And so I say to my mini-me, Francesca, how's the cheesecake? And so she looks at me and she says, well, Mommy, it's not too bad for our first cheesecake, but it's a bit cheesy for me. And so I looked at her with like this quizzical look on my face, and I'm like, but Ladybug, it's cheesecake. So that's what I said to her. My sister subsequently called me later on that evening, and she said, Ange, how'd the cheesecake come out? And so I told her what her niece said. And then I said to my sister, which is what I really wanted to say to my daughter, but I can't use that kind of language with her. But I said to my sister, it's fucking cheesecake. It's supposed to be cheesy. But anyway, it was delicious. So let's jump right into today's topic. To circumcise or not to circumcise? That is the question. It's a bit Shakespearean, don't you think? Anyway, for all of my patients that deliver boys, I walk into the room and I'm like, am I or am I not doing a circumcision? It completely makes my day when people say no, because from a gynecological perspective, circumcision is probably in my top 3 of procedures that I hate to do. And I know hate is a bit of a strong word, but I absolutely hate doing circumcisions. And so, when you're informing patients about the pros and cons, risk and benefits, this is the thing to remember. Even though doing a circumcision takes maybe 5 minutes, it's still a minor surgical procedure. And quite frankly, I don't care if it's major or minor, any surgical procedure is always associated with risk. When you're dealing with circumcision, you're going to be dealing with things like risk of infection, bleeding, actually injuring the penis, taking too much skin, not taking enough skin. So keep all those things in mind. I don't really care why you get a circumcision done. Some people do it for cosmetic reasons. Some people do it for religious reasons. There is some literature that suggests it makes hygiene cleaner, but quite frankly, just don't be lazy, and if you do have foreskin, pull your skins back. There is also some literature that suggests that men that are circumcised have less of a risk of developing cancer. There's also some literature that suggests that being circumcised decreases your risk for things like urinary tract infections, STIs, which stands for sexually transmitted infections. I gotta tell you, I asked some of my male friends that have been circumcised, and a lot of them, or I'm just gonna say some of them, wish that they hadn't been, because they're telling me that it affects, their sensation, if you will, during intercourse. So, think long and hard. A lot of my girlfriends who have boys have decided to let their boys decide whether or not they want to have their foreskins chopped off. But regardless, make sure that you are making an informed decision, okay? So there is today's topic, circumcision or no circumcision. You decide. Thank you so much for tuning into today's podcast. Certainly appreciate all of the love. And when I say all of the love, we are getting love from all over the world. I told you we got that question from Uganda, right? We've gotten questions from Iran, and there's not a lot of stuff that's coming out of Iran, but somehow a question came to me. Anyway, would love for you to keep all the love coming. You can hit me up, www.askdrangela.com, and that's where all the action is going down. You can hear about the latest, news posts, which are my weekly blog posts, which are hilarious. They are so funny. The podcasts are there. We've got a new video segment that we're doing. All of our social media outlets are there. So if you want to reach me, that's probably the best place to go. So in closing, let me leave you with this quote. And actually, this is something that I share with my mini-me all the time. The more you study, the more you get paid. I like that because I always tell her, I know that you want mommy to be home, but mommy doing what she does allows you to have the life that you lead. So until next time, look better, feel better, be better. Cannot wait to reconnect on episode 187 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.